here today after your surgery.
Yes.
And to go back, you and I, we've met each other a long time ago, right?
Yes, ma'am.
And I thought your video would be a very interesting video because you're sort of a patient who has a very interesting history.
Yes.
So you came to me many months ago for your left Achilles pain. And you had a bone spur, and you had Achilles tendonitis, and you had a bone spur that was shredding the tendon. And in the old times, we did that old surgery where I made an incision, I took the tendon off the bone, I shaved the bone spur, and then I reattached it with bone anchors.
Yes.
And you were a very compliant patient, but still it took you a long time,
Yes.
right?
Yes.
So the old surgery, from the time we did it to the time you like stopped limping, how long it was?
It took a good year.
A good year, right?
And then a year and a half, it felt like I think I'm normal now.
Right,
Yeah.
right. So when you came with an opposite foot, you were like panicking, right?
Yes, I was.
And you came to me like about, what, a year ago first time, right? And I'm like, hold on, we have this new procedure.
Yeah.
And, you know, basically, whenever your pain is really intolerable, come back and we'll do it.
That's right.
So 4 weeks ago, we did that new Tenex surgery.
Yes, ma'am.
Well, tell me, are you limping 4 weeks later?
I'm limping a bit, but I'm just being really careful.
Careful,
But it's amazing.
But
It's
like, where is your
amazing.
pain in comparison to where it was before the surgery?
Oh my gosh, yeah, it's like 0-1. There's
Okay.
hardly any pain at all.
Right. And a lot of it, that limping is like almost a habit.
Right.
Right? So just, again, go to physical therapy and, you know, I'll give you a prescription, go somewhere close to home, and don't overdo it. If you're having a bad day, like, you're supposed to have a bad day. Remember, Mayo
Correct.
Clinic says 6 weeks, right?
Right.
So if you're having a bad day, there's nothing wrong with taking a step back and even putting the boot back on,
I do
right?
that. Yes, ma'am.
But bottom line is, we're looking for long-term goals and long-term relief of pain. So, like, we know it worked. Now we just have to not mess it up.
That's right. Yes, ma'am.
Right?
Yes,
Like,
ma'am.
don't mess up my work.
No, I'm not going to mess up your work. I'm a good patient.
You are.
I do what you say
yes.
to do. Yes,
Yes.
ma'am.
So,
Yes,
but,
ma'am.
you know, I think you're a great example of, because you can compare on your own body the old
Yes, ma'am.
surgery.
Yes.
Would you say, do the new surgery?
Yes, ma'am.
Yes.
Try it first for sure.
Try it
yes,
first,
ma'am.
because look,
Yes,
like, I
ma'am.
mean, you're a good example of
Unbelievable.
how, right? It's like 4 weeks versus 1 year. Yeah. Well,
Yes.
I am telling you, I'm getting braver and braver with the surgery, because before I was very careful, you know, and I still did some open surgeries. But once you do the minimally invasive procedure, it's very difficult, even for me as a physician, to sort
Yes.
of go back and say, okay, try to convince somebody to be in a wheelchair for 4-6 weeks, right?
Yeah, it was
And a huge
at least
incision,
that, yeah.
and remember how, like, you have a 30% chance of wound adhesions with an old surgery. So no, I definitely recommend this new one. I'm like with you. I cannot believe how well it works. I'm still like pinching myself sometimes.
Me too. Me too. It's like I'm really walking. It's cool.
Right. Well,